Hello, my name is Dr. Elena Rios. I'm the President and CEO of the National Hispanic Medical Association. For this installation of our Vaccinate for All PSA Series, we wanted to get you acquainted with some of the members of the NHMA family and let you hear the voices behind the Vaccinate for All campaign. We want to encourage all the members of the NHMA community, our partners as well as our champions, to make it a priority in 2023 to be active listeners and to create open spaces for building trust with the patient community. The Vaccinate for All campaign is a campaign led by NHMA and supported by the CDC, with the goal to increase vaccine uptake and build trusting relationships between patients and their providers in underserved communities. We work with community leaders and healthcare professionals who sign up as campaign ambassadors called champions to build dialogue on accessible healthcare and emphasize the role of cultural competence in health equity. If you want to get involved, whether you're an individual or an organization, sign up as a champion at vaccinateforall.org.
The COVID-19 pandemic taught me that vaccination is something that we often take for granted.
I've learned that COVID-19 vaccines are a more safe and effective way to build immunity than contracting COVID, so it's very important to get vaccinated, in contrast to just relying on immunity that you can gain from getting COVID itself.
The bivalent vaccines have made a huge difference in terms of transmissibility and the number of people who pass away from COVID-19 related complications.
I learned a little bit about the bivalent vaccine and how important it's for new variants and potential new hotspots in our communities.
This year, something that I learned with COVID-19 vaccines, especially with the flu season coming around, is that you can get both your flu shot and your COVID vaccine together.
Something that I learned this year was that you can receive the flu vaccine at the same time that you get the COVID vaccine.
And it gives you the extra layer of protection for this season.
The difference with the bivalent vaccine is that it is targeting the current strain of COVID that is going around, and that's why there is such urgency to get that bivalent vaccine into everyone's arms.
So I think that is a really big and important breakthrough as we move towards, eradicating the COVID-19 pandemic.
One of the most important things that I've learned about COVID-19 vaccines this year is just how important it is to always be innovating and coming up with new ways and strategies to try to combat COVID-19.
I keep getting impressed from these technologies and how they work and how they are developed in order to make us all healthier and protect our communities from these viruses.
That the trust in the communities is basically everything in order to get people vaccinated.
I think quality healthcare starts with getting to know your patients.
Open communication is essential, and I know it's challenging, especially when we are living in a community as diverse as the United States or Mexico, where I'm from.
Just remembering the importance of meeting people where they're at. People are at all different levels of health literacy, of general health competency, language proficiency.
Me being African American and a woman, that a lot of times we're misdiagnosed with things and or not taken seriously about the things that we know that are going wrong with us.
I know especially for Black and Brown communities, this trust has really taken a big hit. Historically in the past, seeing how people of color have been treated.
Medical racism and discrimination, violations of our rights throughout history. The medical sector isn't always going to seem the most trustworthy.
There's been a lot of historical abuses and present abuses of certain communities, so it's really important that you build trust with communities that have been hurt.
Communication is extremely important, and also the validation of feelings. I feel like when people go to their checkups, they just sit there. Doctors just want to go super quick, just want to know what their chief complaint is, and are not really listening to the patients.
When you feel comfortable enough to ask your doctor anything that you might otherwise Google and maybe see misinformation on, I think that really is what speaks to a proper patient provider relationship.
Also, people just looking out for each other.
I know with my parents, they prefer a Spanish-speaking provider. They feel more comfortable, and I know they're able to just really communicate with them and tell them what's wrong with them.
Having some trust with the physicians, and the physicians being very transparent about the risk, about the availability of vaccines.
Like a genuine passion and caring for the patient.
If you're a healthcare provider, if you're a doctor or healthcare professional, listen to your patients.
If you start these conversations with the assumption that the other person could be right and you could be wrong, that the other person might have a better approach to whatever you're talking about.
I think it's really important for physicians and doctors to have cultural competency and to understand the cultural values and language and traditions of their patients in order to build trust.
You have to value the voices of the people that you're serving, be an active listener, to value people's stories, and to think about how they might impact their perception of the medical care that you're providing.
So that medicine can be accessible for all.
I think it's important to recognize that everyone faces different barriers to vaccine access, from their own experiences to what they're being exposed to. I know that misinformation and disinformation has been running rampant across social media channels.
So the problem continues to be the lack of trustful information and all of the myths and conspiracy theories that are around.
Because you can have all of the resources and all of the availability in your area, but if you don't trust, the providers, or you don't trust the vaccine itself,
and how they might impact people's desire to seek help or even to adhere to medication, much less to get vaccinated.
You really can tell how a person's health outcome will be based on their zip code. Currently, I live in a predominantly African American area. I recently moved from a predominantly white area, and I can really tell the difference in the quality of care, the access of care, access to COVID testing and vaccination is very different. It's very hard to find testing clinics. It's very hard to find access to vaccines. Even in the targets for self-tests, there are little to none available in stores compared to predominantly white and richer counties in Maryland.
I think definitely the lack of insurance and not knowing where to go to get the vaccine, which is unfortunate because there are a lot of places that they can receive the vaccine for free, and they just don't know about it.
In my community in Charleston, South Carolina, I've seen a lot of barriers to access in the form of transport barriers. People just don't have ways to get to clinics for vaccines. Also, a lot of people work full-time and have robust families, and it's hard for them to find the time to get a vaccine.
Insurance comes into play. Like if you go to a pharmacy, do you have to give an insurance card? Can you only get free vaccines at a free clinic? And not everyone goes to a free clinic. So I think those, when it comes to cost and insurance, that's also an obstacle that I think the community is facing this year.
So it made it a little bit hard for them to have access to getting the vaccine, as well as access to the prescriptions, or, even being able to get to the pharmacy to get what was needed, or even just to the grocery store to get the foods that were needed to kind of help boost their immune system.
It made me realize how important having reliable transportation is, especially for being able to schedule time and go out and get something like the vaccine.
I knew I would be able to set aside a full day in case I got sick. And for people who work multiple jobs or are caretakers for loved ones, it's even more difficult to find a time to get a vaccine.
I'm incredibly fortunate to have a job that gives me the time that I need to take care of myself, and that includes getting vaccinated. While I've been fortunate to have a job that gives me PTO and time off to get vaccinated, I know that not everybody has that opportunity. And so I think it's important that the public health apparatus recognizes that people have varying schedules and opportunities to access vaccination, and it's not just getting to the vaccination site, but also when you're able.
It was definitely a wild goose chase. I mean, I was a master's student working full time. When was I supposed to go get my vaccine?
It's not only resources to get vaccinated, resources to access care, it's also resources to get there.
I think the most important part for the champions is to establish a healthy relationship between them and their community to help spread the word and the awareness of the importance of the vaccine in this pandemic.
And I think the best way that we can serve our communities is proactively combating that misinformation and disinformation with trusted sources, trusted health experts that look like you, that speak your language, and can build that trust that's so incredibly important to help people understand the implications of their decisions.
Scary. We didn't know the severity of it. It was not until schools were closed, and again, a very rural community. And it's everyone goes to the local grocery store. There's one big grocery store. So it wasn't until we realized, okay, the shelves are emptying, things are really happening. This is real.
There were some that were scared to receive the vaccine just because of the lack of trust in the healthcare system.
At first, there was like a group of people who were very eager to get the vaccine. However, there were a lot of people who were hesitant or resistant to getting it. So I would say that the response to the vaccine initially was a little bit mixed. But since then, I think more and more people have gotten vaccinated, which I'm really happy about.
During the rollout of the vaccine, I had the privilege to actually be employed in the COVID response in a local health department in Virginia.
My family is in Mexico and I live here in the United States.
I hadn't been home to Puerto Rico in over a year since living in DC.
I live in a small town in Southern Virginia.
When the pandemic started, I was in Belgium.
When it first became available, I think it was that notion that they were kind of scarce, but then it became like a wait and see, or almost like a game for other folks to try to find ways to obtain an appointment to get the vaccine, myself included.
Because at first we wanted to make sure that everyone was going to have a vaccine. So once that was kind of established, I made sure to make my appointment and get in right after the most important people and crucial to get vaccinated did get theirs first.
I will say it was a little bit chaotic.
Felt privileged to be able to get it, but it was a bittersweet feeling because I knew that my friends who are my age had to wait a few months more to get theirs in Mexico.
And it was very frustrating in the beginning because it created less opportunity for us to actually live on with our lives because there was a constant lockdown. You could only leave the house when you got your first or second vaccine, which limited the capability of younger people living their life, coming out of their comfort zone, leaving the house. It was more, it felt more like kind of a prison for us in the beginning.
Even if you were kind of scared of shots or were a little unsure of how it would affect you, so many people came out and understood the importance of protecting their neighbors and were able to get vaccinated. And even more than that, people were excited to get back to their new normal and seeing their loved ones, their friends, spending time with people, getting back into the community for themselves and for others. So I would just say that it was a very hopeful time. I look back on it fondly because that was one of the big points in my life where I just felt so much hope for our future.
I remember the crazy rush that it was seeing all these e-blasts and emails that vaccines were finally available for us. The idea that maybe, just maybe, we could all finally be safer and work together towards a safer future was something that really inspired me. But it was definitely a wild goose chase. Their distribution was greatly impacted by already existing healthcare barriers. People in underserved communities and people from traditionally underserved minority groups like Hispanic people, poor people, queer people, trans people, homeless people.
So I knew that the speed at which they would be distributed was going to be very different in both countries.
Also, even when we did try to make it more equitable and putting vaccine clinics in, underserved communities, there would be people coming from other communities coming in to take what was allocated to them. So I think there was a lot of inequities and a lot of hard to reach people that really needed to be reached, and a lot of barriers of who comes in, vaccine cards, what dose you have and all that stuff. So that was pretty hard in the beginning.
It just became more of a safety protocol for the community, and so we were able to express the importance of everyone being vaccinated so that we can all kind of just take care of each other by doing our part.
When I was finally able to get vaccinated, I realized that I would be able to have the safety and precaution necessary to be able to see my family again for the first time in so long. As emergency policies due to COVID-19 start to get rolled back, I think it's important for our champions to consider what the pandemic really brought to light, which was healthcare inequities. It's not just unequal in the way that it's distributed, it's not just unequal in its treatment, but it's unequal in the way that we conceptualize health itself. Who are the people that are writing the studies that we reference for vaccines? Who are the people that are running the medical schools that are producing future doctors that are going to help distribute vaccines in the future? Are Hispanic people represented? Are Black people represented? Trans people? Disabled people?
Having a healthcare provider that speaks your language, that looks like you, that understands you and your experiences, and that's also willing to understand and take the time to get to know you and your experiences.
I would like to thank them. I think the work that they do is very important.
I'm proud to be in a coalition alongside you. I greatly appreciate everything you've done to serve our communities, and we look forward to continuing to work together in the new year and in years to come.
It's really challenging and exhausting to have conversations about vaccines a lot of the time, especially with your friends and family. It can kind of put a strain on your relationship when you talk about difficult topics like vaccination.
I encourage physicians to continue to try to build trust with their patients. If there's no trust between you and your patient, then they're most likely not going to want to take any vaccines that are available.
Spend that extra time with them just so they feel more comfortable with you. And again, it's just important for your patient to trust you.
And to make the information available to those who do not have access to that information or had a fear.
Make sure that every single patient that's walking through your door can leave knowing that they can trust you to give them accurate, accessible, and understandable medical information.
Every conversation makes an impact.
I think it's important to still get the message out and to really just hear those people that need to be heard.
I would like to extend the invitation to give us your feedback so we can develop better resources for you, so we can build the connections in a more efficient way, so we can both do a better work at increasing vaccine uptakes in our communities.
Please reach out and let us know if there's something that you need support with, if there's an event that you're doing, any clinics or even educational events, if you need resources, materials, please reach out and let us know.
Thank you for improving accessibility to vaccines. Thank you for giving back to your community and engaging with people. And sharing that important information that we're trying to get out. I would also say, we're here for you at NHMA. We are happy to help you and support you in whatever we can, and we're grateful for our partnership with you and can't wait to see what else that will bring down the line.
And really strive for a healthier future for not only for us, but for the generations to come.
Physicians are the first line of defense for patients and their communities. And to encourage this essential dialogue, we want to challenge you to use #VaccinateForAll to share your thoughts as a leader, patient, physician, or other providers or organizations on the 5 questions we have covered today. Don't forget to tag the National Hispanic Medical Association at NHMA MD.